And tonight, Zack gives us a peek into the whole process of Tommy John surgery and the rehab that follows.
If there's anything more mysterious than what causes a pitcher to need Tommy John surgery, it's what the surgery actually fixes and what that 1 year away from the mound after actually entails. Behind the scenes, doctors are the science behind the surgery. Dr. Nader Paksima is an orthopedic surgeon at NYU Langone, and he specializes in hands and elbows. He says the surgery is all about one ligament.
The essential problem is a tear of the ulnar collateral ligament. And the ulnar collateral ligament is a ligament on the inside of your elbow that sees a lot of stress during pitching.
And then there's the question of how the surgery is actually performed. What are the techniques involved? And how do you decide which one to use?
The classic Job surgery is done by making an incision, identifying the ulnar nerve, protecting it out of the way, detaching the muscles from the humerus to look directly at the collateral ligament. If the ligament can be repaired, it's repaired and the muscles are reattached. If it cannot be repaired, a tendon graft is obtained from the forearm, holes are drilled in the ulna and in the humerus, and then I thread the tendon graft through the holes and back onto themselves to tie them back together to recreate the original ulnar collateral ligament.
While the surgery grabs most of the headlines, it's really the rehab process in the weight room with therapists that determines whether the surgery is going to be successful or not.
Good, so this is a good exercise to start with your rehab.
April O'Connell is an occupational therapist at NYU's Rusk Rehabilitation Center, and she specializes in hands and elbows and has worked with pitchers recovering from the surgery. She says that while the causes for having to get Tommy John might seem like luck, they actually have a pretty good idea of the causes and a much clearer path to recovery.
We absolutely have an idea of what's causing the UCL injuries. It's the amount, the frequency, and the velocity of pitching.
In the past 2 years, 46 Major League pitchers have undergone the surgery, and it's estimated that over 400 Tommy John surgeries have been performed in Major League Baseball since Dr. Frank Jobe first did the surgery in 1974. There's no question it's an epidemic, but the question is, what causes it, and how can it be prevented?
So we're going to warm you up. And so instead of warming you up by doing throwing exercises, we're going to warm you up by getting the small muscles in the rotator cuff, the serratus anterior, the shoulders all warmed up.
And the older the surgery gets, the younger the patients seem to become. Preventing injuries has come a long way, but overuse still occurs and is generally considered the underlying cause of the injury.
They've come up with those rules and regulations so far, which I think is a helpful thing. But there's still players, and the players' parents, I find, are even worse, have a way of getting around everything by getting them into multiple leagues. And I think that's an issue. Also, I have a problem with the showcases, because you're going around and you're showcasing your arm, and you could have 4 showcases in one day.
We found that you're up to 36 times more likely to sustain this injury if you're throwing with an arm that's already fatigued, and 4 times as likely to get this injury if your pitch count is over 80. So the recommendation that the orthopedic community has made to coaches and pitchers is there's certain things to avoid. For example, breaking pitches should be avoided in the younger population. It just puts too much stress on a growing elbow that's not really designed to withstand those kinds of forces.
So more in the advanced stage, once we can get you to throwers 10, we want to start with plyometric drills. Sometimes players can be a little apprehensive about this because this puts a lot of stress into the UCL. So this is a very advanced exercise that you're not going to do till you're at least about 5 months or so, depending on the doctor.
And the way younger patients and professional athletes respond to the surgery can be completely different. Plus, there is no guarantee any pitcher will come back to be the pitcher they were before the surgery.
That is the misconception, that people are going to come back and play at that same level. So there was a study done by Dr. Andrews and his group where they looked at about 740 athletes after 2 years of having a Tommy John surgery, and about 80% of those players were able to come back and pitch at a high level, at the same level they were pitching beforehand. 20% of those players were unable to. so they did not come back at full strength. At this stage in therapy, you're going to be around 16 to 22 weeks. In your case, we started you throwing around 20 weeks. It depends on the surgeon's comfort level and where you are competitively. So if you're maybe a professional athlete and you're really pushing through rehab, you might start competitive throwing or just the interval throwing phase around 16 weeks, phase 1. And then phase 2 won't progress usually until around week 24. And then you're not going to start throwing at more competitive levels until week 32, 34.
As for why elite pitchers might respond better to the surgery than their younger counterparts, that all has to do with what they have surrounding them.
I think it's because of the team surrounding the elite athlete. You're going to have a nutritionist, you're going to have a sports psychologist, you're going to have your strength and conditioning coach, you're going to have your pitching coach, and then your OT or PT, and then your athletic trainer. That's all going to be surrounding the elite athlete. They're going to be getting the best information and the best type of therapy every day.
If your job is to do the rehab, to really spend a year recovering, and you're under the proper kind of supervision, then you're much more likely to have a better result and be able to return to your prior level.
If there is one aspect of Tommy John that we have yet to see, it's how the repair will hold up over time. With pitchers getting the surgery at a younger age, needing multiple Tommy John surgeries could become more common.
We're now getting into our second generation of Tommy John surgeries because those guys who've had their first Tommy John are now back at it, and now they're getting the same wear and tear that people who haven't had a Tommy John surgery would get with regular pitching, and they're in for their second round. So now we have to do the research of what's happening with the people who have gone in for their second round of Tommy John surgery.
Until then, pitchers will continue to perform the rehab process that has helped many pitchers return to the mound following Tommy John surgery. Zack, New York 1.
And in part 4 of our series tomorrow night, Zack explores the career of Tommy John himself and how, despite 288 big league victories, his name has come to symbolize the surgery that has affected thousands of baseball players and has helped save the careers of hundreds of major league pitchers.